Worth remembering that this parasite, this malaria parasite, has been around 30 million years and has affected other countries. In the 1930s, it was in Italy, it was in England, it was even in Washington, D.C. This particular disease, malaria, or this infectious disease, kills millions of people every year and is a far greater killer than COVID-19 or other infectious disease it's particularly here in Africa, in sub-Saharan Africa, touching specifically children. So this is a significant breakthrough, and in the words of WHO, it is a vaccine found by Africans for Africans. And so this has a significant impact. It was researched and trialed in Ghana, Nigeria, and Malawi. 2.19 million doses were distributed to children. Now, these are 4 doses over the course of 18 months since 2019. And following that trial, the World Health Organization has given its go-ahead for the pharmaceutical company GlaxoSmithKline to now distribute those vaccines to those that need it the most. The challenge next is obviously to reach those that need it most, which is mostly in poor African countries, in places where there's a fragile health system. Lauren?
And they're saying that 30% effective against severe disease. Is that enough?
Well, you know, the difficulty in trying to find a vaccine against malaria is, in comparison to COVID, for instance, that has only 12 genes, in COVID, there's 5,000 genes in malaria, and that's why it took so long to try to actually find a vaccine. There's also the efficacy is obviously a key problem here. 30% efficacy is not enough, but it's better than nothing, especially in areas where people are being infected by the virus. Now, if you combine this vaccine with anti-malarial drugs, then that bumps up to 70% efficacy, and that's what the WHO, the World Health Organization, is recommending, that people take this hand in hand with anti-malarial in order to make it more effective, especially in young children. And this vaccine specifically targets falciparum malaria. There are 5 pathogens. This is the deadliest one, this one that transforms into cerebral malaria. And so this is a major breakthrough to try to end the deaths. It won't mean it's the end of the malaria parasite and people getting infected with malaria, or getting bitten by mosquitoes that carry malaria, but it certainly means that there are far greater chances for young children to survive malaria if they have this vaccine. It's also worth remembering that the WHO took a long time to actually give its approval to this vaccine, because in comparison to other existing vaccines, such as measles or chickenpox, there's a 90% efficacy. So this one has a particularly low one. But I think the effect of COVID-19 and its vaccine that has, in some cases, a lower rate of efficacy, has changed the steps in which WHO accepts vaccines. And that has allowed this particular malaria vaccine to be accepted by WHO. But it's worth remembering that scientists have been researching this for a number of years, 30 to 40 years, to try to find a solution and an end to this. And some of the researchers that we spoke to in Germany say that one of the reasons why there wasn't more of a speedy way forward for pharmaceutical companies to roll out a vaccine is that it simply isn't cost effective for them, because people who are being affected by malaria live in poor areas, poor communities. So there are still a number of hurdles to get through, such as the cost of this vaccine. How much will it cost? And there's also vaccine reticence, just like there was in COVID. Will people be willing to take those vaccines, especially in places in remote areas where health facilities are far to reach? It will be the added challenge for WHO and for health workers to try to get those vaccines to those that need it the most.